name is Latasha Jones, and I'm a student with the College of Central Florida. Today, I'll be demonstrating a wet to dry dressing change being sterile. To start, I've already verified the doctor's orders, and I compared them with the patient. I went ahead and already assessed the patient's pain level, but I'll go ahead and also do it when I get into the room. Before we start, all of my supplies are also in the patient's room, so I'm going to go ahead and get started. As I'm entering the patient's room, I'll knock on the door. Knock, knock.
Come in.
I'm closing the curtain to provide for privacy. Good morning, Mrs. Jones. How are you?
Good.
Doing hand hygiene. My name is Latasha. I'm a student with the College of Central Florida. Can you tell me your name and date of birth?
Miss Gloria Jones, 7588.
Thank you. The name and date of birth matches with my MAR. Now, Mrs. Jones, this morning, like as I had told you previously, I'm going to get ready to change your dressing, and we're going to irrigate it with a little water. We call it normal saline, but you may think of it as a little salt water. Now, how's your pain? Do you have any pain to that right thigh?
No pain.
Okay. I'm going to go ahead and get started. Now, before I start, are you allergic to any tape or any adhesives or anything like that?
No.
Okay. So I've checked her allergy. She's not allergic to anything, and she doesn't have any pain, so I can begin. To start, I'm just going to go ahead and get the bed up to a level that's good for me. I'm putting your bed up. I'm going to also put your head down just a wee bit so I can get a better grasp of that thigh. I have a trash can here. Go ahead and perform some more hand hygiene before I get started. I have my red biohazard bag that I'm going to open. And I'll just put this bag here, and I'll put the old dressing inside of the bag. I already have my tape set up, and it does have a barrier down, and I applied the tape that I'll be using for the dressing on top. I have some clean gloves, sterile gloves. I have an extra set of sterile gloves in my pocket, the irrigation tray, and also the normal saline to irrigate the dressing with. I have all of my supplies. So I'm going to go ahead and get started. Go ahead and put on some clean gloves so I can take off the old dressing. Put the chucks down. I'm going to take off the old dressing. As I'm taking off the old dressing, I'm being sure to apply down towards the skin, which makes it come off a little easier without ripping the patient's skin. Came off pretty easy. I'm going to go ahead and take off the entire dressing. Being sure to grab all of the contents of the dressing in one pool. At this point, I'm gonna assess for coca. I'm gonna assess the color, the odor, the consistency, and the amount of the drainage from the wound. I also look at the wound bed. I will look to see if there's any drainage. I'll look at the surrounding area, the surrounding skin to the wound. I'll also look at the wound bed to know any necrotic tissue or any granulation tissue as well. So I'm going to go ahead and just throw this away. Take out the gloves. On a little hand hygiene again. I'm going to lift this side further down and sanitize my hands a second time. Go ahead and open up my supplies. I'll start with the irrigation set. Now my normal saline, the expiration date, it has not expired. It's January 1st, 2017. So it's not expired, it's brand new. So I can go ahead and use it. The contents are clear. There's no particles, so this will be good to use. The inside of the container is sterile, so I will just go ahead and open this up. Apply the label to my palm and lip it. I know it's unused, but just to maintain sterility, I would just lip it then and pour some saline into the container. Still being sterile, and just sit that there. I'll take the basin and just apply it here. And I go ahead and open up my contents sterilely. These are my sterile 4x4s. And my ABD pad. Have a 1-inch border. I'll go ahead and reach over here, and I'm gonna just moisten one of these, which would be this one. That's what I'm going to use to place inside of the wound. Put on another set of clean gloves so I can go ahead and irrigate. At this point, I'm going to withdraw some of the solution, maintaining sterility. I'm going to come out, and I'm going to irrigate the wound bed from top to bottom. Okay, Mrs. Jones, I'm getting ready to water the wound, and I'm irrigating from top to bottom. Irrigating very good. The basin's there. I'll put that back in, and I'll take a dry gauze, this one here. Parachute it closed, and then I'll go ahead and dry the area. Take out those gloves, and I'll come over here and don my sterile gloves, so I can place the material inside of the wound. I'll pick those up off the floor. I'm going to start with my dominant hand. I'm going to step back. Sterile can touch sterile. Still sterile. Put that to the side. I'll take one of the gauzes that are wet. Take it here, and I'll just fluff it out so I can pack it inside of the wound. Try to get it nice and fluffed. Go ahead and put it inside of the wound. If any edges are on the outside, I'll leave them on the outside so that I'm not contaminating the wound. I'll take 2 dry gauzes and place them over my wound. Then I'll take my ABD pad, or absorbent side down, and place it over the wound. Take a piece of my tape, point, I'll also discard my gloves and finish taping the wound. The sterile part has been performed. On my last and final piece of tape, I'll take my pen. I'll date, time, and initial. The piece of tape with my initials, date, and time. And I will apply it to the wound. Now, in the video, my other gloves had just fell on the floor. In real life, I would go and grab some more gloves, more clean gloves if I need be. But I'll just go ahead and clean up all of my, gather all of my supplies, clean up my material. How are you doing, Miss Jones?
Good.
Good. Trash this. These will remain in the patient's room. So I'll place them over here to the side, the patient's bedside, clean up my mess. I'll take my biohazardous bag out with me. Make sure that it's closed pretty tightly. And I'll put this in the biohazardous waste. I'll cover Miss Jones up. How's your pain, Miss Jones?
Still no pain.
Okay, good. Good, good, good. Here's your call light. If you need anything, I want you to call, okay?
Okay.
Gonna put your bed back down. Do you want to stay lying down?
Yes.
Okay, good. Okay, bed is in low position, the sour is up. Go ahead and sanitize my hands before I go out. Okay, Miss Jones, I'll come back to check on you in a little bit.
Okay.
As I'm leaving the patient's room, I will open the curtains. Hand hygiene has been performed, and I'll get ready to document my findings and document my completion of the wound change.